Since the beginning of COVID, I know of 41 people who have died of overdose.
Those who work with people battling addictions are sounding the alarm over code red COVID restrictions in the province that will limit the amount of people who can access 12-step programs or addiction help services here in Manitoba. Overdose deaths are on the rise in both Ontario and BC, according to their government. The Public Health Agency of Canada says the opioid overdose crisis is now one of the most serious public health crises in Canada's recent history.
Accessing these programs, in person, although some, there are some, problems around COVID, are an essential service, as are, if you were to have a heart attack and needed to go to the hospital and needed stints. That's how these services are for us. They're a lifeline.
Ian Rabb is in long-term recovery, almost 20 years sober, and now works with a Canada-wide addiction support network. He says he went to multiple meetings a day when he was first trying to get clean, and says the 5-person max on meeting size imposed by the province means many people won't get the help they need. He says the government should reconsider the number of people who can gather and receive addiction support through meetings as drug overdose deaths continue to climb in Canada.
So the problem with 5 people in-person meetings is that ultimately sometimes 15 to 30 people could show up. So at 8 p.m. there's a meeting, we let 5 in and send 15 or 20 people home and send them where? Back to their homes to isolate?
Rabb says in-person meetings can be done safely with social distancing, but doesn't believe virtual meetings are the same. He says someone new to sobriety needs a physical community of people to help and support them, and in-person meetings should be considered a critical essential service at this time.
I sit and think about the fact that liquor stores are open and marijuana stores are open, but the place that people need to heal and get well, to become full members of society and better for themselves and their families, is really restricted by the closures.
City News reached out to the Manitoba government. A response reads, organizations providing mental health or addiction services are permitted to open under the orders, and the orders allow community centers to be open for activities permitted under the orders. So yes, in-person 12-step meetings in community centers are permitted, but they are subject to the gathering limit of 5 people. However, in-person meetings are not recommended at this time, as the orders require religious facilities to close. Activities such as AA meetings are not permitted in these facilities under these orders. In the meantime, Rabb worries things will get worse before they get better, and he believes the number of people who are suffering with addiction and mental health issues will skyrocket. In Winnipeg, Mark Neufeld, City News.